What is an acceptable range for a person to keep the visceral fat percentage in check?
Total amount of fat percentage, ideally in a male or female. Female, it should be up to 25 is fine. For male, only 15% fat is there. But averagely, what I am seeing with the body composition analyzer, which we do for our routinely patients, we are finding 35 to 40%, 45% in the female and around 30-35% in the male. Now, this is overall total body fat percentage. Now, fat is again in the two parts. One is in subcutaneous and other is in visceral fat. So, subcutaneous fat is having good insulin sensitivity, while visceral fat does not have that much. It is more insulin resistance. What is visceral fat? It is inside the viscera. It is inside your abdomen where other viscera are also there. So, I mean, it is in between your pancreas, in between your liver, in between your guts. There is a fat which is there. While the outside fat which we are seeing is actually subcutaneous fat. But what happens when the person's body weight increases? The body tries to store it first in the subcutaneous fat. But then when it increases more, it also increases in the viscera. Then it also increases in the liver. So then everywhere the fat will increase, That is what going to happen. The primary storage area is subcutaneous area only. But to know somebody's how fat is, we have to measure the subcutaneous fat, which is easily measurable. You have to just do the central obesity. Here, maximum amount of the fat is in the subcutaneous area. But I am sure if somebody have this much belly, it means there is a good amount of fat is also inside the viscera too. With the DEXA scan, you can find out exactly, or with the MRI scan, or even positron emission tomography also, the PET scan can tell you that how much you have in your viscera, fat is there, and how much there in the subcutaneous. But for clinically, we need not to go for all these high fat tests. We just normally ask what is the BMI and what is the central obesity. The perfect is when person's height, I mean the waist circumference should not be more than half of the person height. So if my height is 170 centimeter, my waist circumference, my abdominal girth should not be more than 85 centimeter. That is the limit for that. If it is more than that, then definitely there is a more amount of visceral fat.